Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And in this particular video, it's about raising our level of consciousness. And I want to talk about Trump's new tax bill and the supposed Medicaid cuts for millions of Americans that are going to get kicked off of Medicaid, which we all know or should know that Medicaid provides health insurance for many, many millions of low-income individuals who even have jobs. So Medicaid is just not for the unemployed; it's for the employable who are receiving low wages. And then again, of course, Medicaid and Medicare are kind of tied together. Medicaid is for under 65 and Medicare is for 65 and over. And there will be some trickle-down effect, not only from Medicaid cuts, but Medicare cuts. So this can affect, these cuts could affect children that are on Medicaid, all the way up to elderly people who have Medicare. So let's talk about what this bill that Trump's trying to pass. And remember, your vote is your power, and don't only pay attention to who the president is in the Oval Office, but make sure you hold your senators and Congress people accountable, because for many of these legislative bills that Donald Trump is trying to pass, he's got to get congressional and Senate approval. So we can't only blame Trump. If these kinds of bills that you don't like pass, you need to blame and point the finger at your Congress people and your senators. So let's get into it. How Trump's tax bill could cut Medicaid for millions of Americans. The Senate cleared President Donald Trump's domestic spending and tax cut bill that will enact steep cuts to the nation's safety net health insurance program for low-income families. In addition to delivering tax cuts and increasing immigration enforcement, what Trump has called the Big Beautiful Bill would cut nearly $1 trillion from Medicaid, the state federal health care program for low-income families and the disabled. The bill is projected to eliminate insurance coverage for 11.8 million people over the next decade, according to the nonpartisan Congressional Budget Office. Now look at it, listen to that. It can affect children, disabled folks, and definitely a broad brush across low-income individuals who desperately need health care coverage the most. Trump is trying to, him and this DOGE department that he has created. DOGE has gone after nonprofit or a lot of the alphabet organizations that the government has had for many years, calling many of those alphabet agencies government waste. And now, for some strange reason, I guess he thinks there's government waste with Medicaid, and he's talking about cutting nearly $1 trillion. Another 5 million could lose coverage if Congress doesn't extend the COVID-19 pandemic era tax credits that have made Affordable Care Act plans more affordable for consumers. Now you got to remember, listening to this article, it talks about the Senate clearing President Trump's domestic spending and tax cut bill. And then here again, you're talking about the Congress with the COVID-19 pandemic era tax credits. So you got the Senate and the Congress. You got they have to make the president accountable. it says that the legislation amounts to the biggest rollback in healthcare coverage in the history of the United States, said Joan Alker, a research professor and executive director and co-founder of Georgetown University's Center for Children and Families. Vice President J.D. Vance, who cast a tie-breaking vote on July 1st, which is just a few days ago, to pass the Senate Bill 51-50, said in social media posts that the Medicaid cuts are immaterial compared to the savings the bill will fund through bolstered immigration enforcement. That sounds like a very callous statement for Vice President J.D. Vance to say in reference to these Medicaid cuts when you're dealing with human beings, their lives, and of course their health. How could he refer that to be immaterial? These are, his comment is inhumane. And these people are not immaterial. They are real human beings that need help and assistance, the bulk of middle class and lower middle class America. This goes on to say the House scheduled to consider the legislation on July 2nd, which was yesterday, in advance of Trump's self-imposed July 4th deadline for his signature domestic policy legislation, which will be tomorrow, Independence Day. So how will the legislation cut Medicaid? It's very important. Listen to these words. Talking about the Senate, the Congress. I talk about legislation. Pay attention to how your politicians write their legislation. The power of the pen, not the words that come out of their mouth. Pay close attention to their actions. So it says the legislation will require states to double eligibility checks. They're going to do it twice a year, where people that have been on Medicaid, generally their eligibility checks is just once a year. So you're going to have to add staffing individuals in these government agencies throughout each state to do these double checks. Now you're giving one person an added job, and you're going to have to add other people, which will cut into the so-called $1 trillion deficit, $1 trillion deficit that Medicaid, that they're trying to remove from Medicaid. So they're going to still have to add manpower. So in the one sense, you're cutting Medicaid benefits to cut the deficit, but you're going to add manpower, which is going to increase the cost of government employees working there. So they're going to say the legislation will require states to double eligibility checks to twice a year. And states which administer Medicaid would have to set up systems to verify a person's employment or exemption status. The legislation requires able-bodied Medicaid recipients, listen to this, to work up to 80 hours a month or qualify for an exemption. So you can be on Medicaid. There's this big misnomer about people that receive Medicaid that they're not working. That is not true. Medicaid is provided for low wage earners and to help them assist that they can't afford. Either they're not getting health coverage through their part-time job, or their job, like a waiter or a waitress, their job does not provide medical coverage. So that's what Medicaid is there for. So it says the legislation requires able-bodied Medicaid recipients to work 80 hours a month or qualify for an exemption. And the exemption would be such as being a student, a caregiver, or having a disability. So the exemption is a student, a caregiver, or having a disability. The original House version limited the work requirement to low-income adults with children, but the Senate version added the work requirement to parents of children older than 13. The legislation defines able-bodied people as those that are not medically certified as physically or mentally unfit for employment. So that's what part of the able-bodied is for people as those who are not medically certified as physically or mentally unfit for work. The legislation also strips coverage from undocumented immigrants who get Medicaid through the state-funded programs. So this huge influx of all of these illegal immigrants, which have put a strain on our social services system. Part of your social services system is Medicaid, which provides coverage to the unemployed and low-income wage earners. We got like 15 to 20 million individuals. So Trump is going after deporting many of these illegal immigrants. And also he's saying, well, if you're here and you're illegal, we're going to cut you off of the Medicaid, which has put a strain on the medical and social services system. So now we got, at some point, you're going to have all these illegal immigrants here, and they can't even get health coverage. And when they get sick, it is going to put a heavy strain on our emergency rooms at our hospitals and or at our urgent cares. And they will not get a check for seeing these uninsured individuals. It says health policy experts say more frequent eligibility checks and red tape will add to the administrative costs and cut off people who qualify but fall through the cracks because of administrative miscues. So like I said, now that they're gonna check it twice a year versus once, you're gonna have to add people at work to handle that eligibility requirement and check off. So what do hospitals and doctors think of this bill? Medicaid insures 83 million low-income children, 83 million, and adults, according to KFF, a health policy nonprofit. That represents more than 1 in 5 Americans. So 20% of our American citizens have some form of Medicaid. 1 in 5. So this is going to affect nearly 20% of our breathing human beings in America. That's a huge number. Health policy experts have warned the cuts could harm rural hospitals and doctors who serve a higher percentage of people enrolled in Medicaid. So, of course, rural areas, you're going to be talking about heavily inundated, poor white folks. And, of course, in our urban cities, where you're going to be talking about a high level of poor black people. It says a Senate bill added a $50 billion rural health care fund, doubled the amount that an earlier version of the legislation proposed. Still, hospitals are deeply disappointed. The bill cleared the Senate, said Rick Polak, president and CEO of the American Hospital Association, a trade group. He was saying, that hospitals are deeply disappointed the bill cleared the Senate. Polak said the $1 trillion in Medicaid cuts would cause irreparable harm to our healthcare system and reduce access for care or to care for all Americans. So these individuals losing, these poor individuals, black or white, this colorless, this is an economic issue. There are going to be an increased number of deaths as a result of these cuts. You already have this kind of montage where low-income individuals don't want to go to the hospital, don't want to see their doctors on a regular basis anyway. They have poor diets, eating junk food, and have low rates of going to see healthcare providers. And now if these Medicaid cuts go into effect and these people are uninsured, they're definitely not going to go to see their doctors, and they're only going to end up at a hospital for emergency basis and for serious life-threatening situations. So you will see an uptick in the mortality rate of individuals that probably could have been saved, their lives could have been saved if they still had Medicaid. Said hospitals are required to diagnose and stabilize anyone who visits an emergency room. Eliminating coverage of nearly 12 million Americans will drive up uncompensated care for hospitals and health systems, Polak said. And remember, this goes to urgent cares too. Polak said hospitals might be forced to cut services and staff, and patients could face longer wait times in emergency rooms. Some rural hospitals and facilities in underserved communities could close, Polak said. And you're going to get longer wait times in emergency rooms because that's going to be their doctor's appointment. They're going to wait to the last minute when their blood pressure is extremely high, their sugar is extremely low, they're in a crisis moment. You're going to have there's going to be an uptick. There are going to be more people that are going to the emergency room as a result of them not having any health coverage. Dr. Richard Besser, president and CEO of the Robert Wood Johnson Foundation, said the cuts to Medicaid and federal food assistance programs will make our country sicker, put children at risk of going hungry, and make it harder for families to afford basic necessities while delivering tax cuts. Because remember, Medicaid many times is also tied to food stamps. Low wage earners or unemployed individuals who are on Medicaid typically get some food assistance, which we call SNAP or food stamps. So those would get cut. There's a watered down deleterious effect that happens. Medicaid being cut, and then your food stamps are being stripped. So then you're talking about a hunger issue, and how are many of these individuals going to feed themselves? And so we're saying, when will the Medicaid cuts take effect? Medicaid recipients won't immediately be impacted by the legislation. The bill sets a January 1, 2027 deadline for states to begin the twice-a-year eligibility checks and verify work or exemption status of non-disabled enrollees. However, some states already have submitted waivers to the Centers for Medicare and Medicaid Services to begin Medicaid work requirements. CMS, which is the Centers for Medicare and Medicaid Services, chose to approve the waivers and allow some states to launch Medicaid work requirements before January 2027. A KFF survey found nearly 2 in 3 people on Medicaid are employed full or part-time. So it is a misnomer for people to think that many individuals that are on Medicaid are not working or not trying to work. 2 in 3 that are receiving Medicaid are working full or part-time. And others would qualify for an exemption from the work requirement because they are caregivers or students. Just 8% were not working due to inability to find work. Either to find work, or they could be in retirement or other reasons, KFF said. While the bill doesn't mandate work requirements before January 2027, states will likely need to plan for big changes before then, said Jennifer Talbert, Deputy Director of the KFF program on Medicaid and the uninsured. States will need to prepare for smaller Medicaid payments from the federal government while adding the extra administrative duties of verifying an enrollees' work or volunteer status. So just what I said, they're going to make the Medicaid cuts, then they're going to double the work for that person that's working there, and because now they're going to go from 1 time a year for eligibility to twice a year. Some states are anticipating this reduced revenue. And you got to remember, in these hospitals, in order for these hospitals and these urgent cares to sustain themselves, they depend on these Medicaid and Medicare payments. You're talking about 20% of our populace that is on some form of Medicaid. That is a revenue generating source for our hospitals, our doctors, and our urgent cares. They're saying that some states are anticipating this reduced revenue, and at the same time, they are also required to make pretty costly changes to their eligibility systems. Then it goes on that Johanna Alabi's days usually consist. This is a person who works at a nursing home. Her name is Johanna Alabi's days usually consist of feeding, bathing, and caring for residents at 2 nursing homes in Bloomfield, Connecticut. She said most of her patients depend on government health insurance programs, so she is concerned about what will happen to them and her job if Trump signs the bill into law. And my family, we have been in the residential care and assisted living business for over 40 years. And every one of our residents has some form of Medicaid and or disability Medicare, or over 65 Medicare. So every one of them has Medicaid and Medicare. And in order for our facility, any of these facilities, to survive, whether it's you have different levels. You have residential care, nursing, assisted living, nursing home care. They are dependent. So nursing homes, assisted living facilities are going to be deleteriously affected by these Medicaid cuts too. So go down the line. Hospitals, physicians' offices, urgent cares. And now you're talking about residential care facilities, assisted living facilities, and nursing homes. Medicaid is the primary payee for 63% of nursing home facility residents. That's what I just said. And an additional 13% rely on Medicare as their primary payer, according to KFF, a health policy nonprofit headquartered in San Francisco. So these places depend on Medicare and Medicaid payments, distributions, or reimbursements. So here again, hospitals will be affected by this, urgent cares. Our healthcare system is on the brink of being fragmented, fragile, and falling apart. You got to remember there are certain layers. There are several pillars to starting a healthy society or sustaining one. What are some of those pillars? You need a healthy school system. You need a healthy medical system. You need grocery stores. You need a healthy public safety system with policing, firefighters. So there are several. You need a healthy educational system. So there are several pillars to a sustaining healthy society. And in America, it looks like our healthcare system is getting ready to be even more fragmented than it has been in the past. If some of that money is going to be taken away, something has to give, Alabi said. It's going to come down to the residents' care. It's going to come down to their food. It's going to come down to their activities. That's why she was inspired to join the Service Employees International Union to lobby lawmakers to vote against the bill last week. She said they arrived at the Capitol with signs reading "Death by a Trillion Cuts" and wearing shirts with the message, "Republican cuts kill." And so this, here again, this is a Republican-led bill. And for all of those individuals, whether you are low-income white, low-income black, who decided to vote for Trump and wanted him to be in office, no different than a lot of Hispanic folks that voted for Trump. And this is a thank you that he's going to give you by cutting off your health care benefits with Medicaid. Also, there will be a downtrodden effect with the SNAP and food stamps. That has the potential to be cut off. And then there could be issues with Medicare cutoffs. So if you did vote for Trump, this is what you're going to get. And now we have to face reality. And hopefully this bill does not get passed in the next day. And I wanted to do a video because it's fastly approaching us. I am not for these Medicaid cuts and how it's going to affect at least 1/5 of our populace in the United States of America. Uh, Low income and middle income individuals are the heartbeat of our manufacturing and distribution, our restaurants, our agricultural systems, and these individuals need to have a sustainable healthcare plan, and Medicaid has been very helpful over the years. Medicare and the food stamp program needs to be left alone. Tell me what you think. This has been the Trevor Donald Experience.